So right now it is estimated that the bioeconomy is around $85 billion and expected to rise to $150 billion by 2025. Our strength is our manpower, you guys that are going to go in big industries, become researchers, scientists, entrepreneurs, and drive this particular bioeconomy. The labor force in India is very cheap when you compare to any other country. If you compare the same position in India to China, which sells dirt cheap material, still the salaries are 3 times higher, right? So manpower in India is very cheap and it is world-class manpower. The institutions that we have are world-class. We have more than 5,000 biotech setups, which are expected to go up to 10,000 by the next 3 or 4 years. We have cost-effective manufacturing facilities. Now, what are the strategies that are needed in the future? We need to have more institutions that focus on entrepreneurship, that focus on that make the manpower ready for these kind of ventures, not the regular the curriculum has to change. It has to implement intellectual property rights. It has to incorporate many other things, the management component, so that the students fresh out of college have that knowledge and the capacity to venture into this particular field. Unnati Biotech Mission has been started by the government of India, which is aligned with global priorities and One Health initiatives. Atmanirbhar Bharat is again boosting this particular field. Partnership, both national and international, central government, state governments are coming together. We have many MOUs with different countries. We have MOUs with EMBO. We have MOUs with Australia for golden rice. For fortified bananas, we have a MOU with Australia and many other South Asian countries. So international partnerships are very much needed. Empowering the rural sector, you will be amazed to know that most of the inventions in our country are not made in urban areas. They come from the rural areas. While I was working with Shriram Institute for Industrial Research, there was a guy who was illiterate from Muzaffarnagar district. He had made a small device which could charge your phone with the help of walking. So it was a small device that was embedded in the shoe, and there was a small wire that would run from your pants up to your pocket, and you could charge your phone. And he was completely illiterate. You must know about this bio toilets in trains, right? So earlier the trains used to be open, the toilets used to be open, right? So suddenly they closed them. So I met the guy who made a very simple invention. So his invention was that underneath the toilets in the trains, you put a clamp, so it remains closed, right? And there was a fan attached to it. So as soon as the train would hit 40 kilometers per hour, so that would happen way beyond the railway stations once the train was out of the city or whatever. So as soon as it hit 40 kilometers per hour, the fan would rotate and it would open the lever and the toilet would be cleaned. Very simple innovation. And it was implemented in almost all the trains at that time. So Unnati Bio Mission is again a Government of India initiative wherein they have taken some priority areas and they have put a lot of focus on them, a lot of focus in the sense of they have many institutions that have come together to work on this. They have pumped crores and crores of rupees into these missions, like Garbini, which is for child, maternal and child health. You have Indian CP for vaccination. You have Poshan Abhiyan for malnutrition kids. You have antimicrobial resistance program, which is headed by National Center for Disease Control. So these kind of programs have been set up in the country so that people can be associated with it. They work very targetedly. They are very focused on particular problems. AMR, I hope all of you know what is antimicrobial resistance. That is through the abuse of antibiotics and rise of antibiotic resistance in the pathogens. Right. So these kind of programs, and then you have clean energy program. Building a Atmanirbhar Bharat, this term, I think everybody is very clear about it. So in this, the government of India has stopped importing some of the key components. Recently, there was news and a statement was made by the Honorable Health Minister, Mr. Mandviya, that India is currently making more than 50 APIs in India, which were earlier procured from China and other countries, right? So we have started manufacturing our own APIs. Although India is the highest manufacturer of generic drugs in the world, the active pharmaceutical ingredient used to come from China, right? So we have started doing that. Uh, genome sequencing, during COVID, I think everybody must know what genome sequencing is. So whatever instrument is currently being used in India for genome sequencing, whatever consumables are being used, none of them are manufactured in India. So imagine some foreign country someday saying, we are not going to supply you with this particular product, right? So it has to be self-reliant. We have to be self-reliant. Most of the food that you eat, it is grown using seeds that are supplied by Monsanto, Myco, and those companies. So imagine a foreign company saying, we are not going to sell you, let's say, cotton seeds or anything else. So you need to be self-reliant, and the government of India is very serious about it. Uh, I have been in some of the meetings, and all hell breaks loose when when the minister talks about it. So we need to be very much self-reliant in all of these. Like I said, in government institutions, you cannot buy any product that has less than 20% local component. So those kind of initiatives have been started to make India self-reliant. So Indian bioeconomy by the next 2 years is expected to reach $150 billion. Uh, the number of bioincubators, I hope you know what are incubators. Incubators are basically facilities wherein you as an entrepreneur who does not have much of corpus, much of equipments and all. So they provide you a safe space. They provide you with all the facilities. They provide you with hand holding. They can help you get more funding. So they are called incubators. So in Delhi, we have a lot of incubators. I think DU has started with one. South Campus, we have one that was earlier known as Technology Business Incubator. Now it's called BioNest. It is funded by BIRAC. So they have 300-liter fermenters. They have incubator shakers, biosafety cabinets, all of them. So you as an entrepreneur can go there and you can start your incubation as low as 6,000 rupees. So you just have to pay them 6,000 rupees and you can start going there every day, working there, right? So these kind of incubators are commonly being set up. Biomanufacturing zones are being made like special economic zones. Biomanufacturing zones are being set up with special focuses like vaccine manufacturing, like API manufacturing. So they are also helping entrepreneurs. Like I said, we have a lot of national and international collaborations, which again help us in driving. We get when we collaborate with institutes like EMBO, EMBL, we collaborate with developed countries. We get very good brains working with us. We get their expertise in technologies that have not entered into our country so far. So it works both ways, and they get access to our resources, our gene pools, which they don't have access to. If I give you one simple example, if any drug has to be launched in Japan, they won't launch it until and unless they use that they have clinical trials on Japanese people. In India, we don't have any such mandate. If it's working on Americans, we will just adopt it. But it does not every time work like that. Right. So India has a very diverse gene pool. India has a huge population. India is a hub of clinical trials. So they also get access to all of those things. So it's a mutual beneficial to both of us. We are supplying most of our generic drugs to Latin America and Africa. So collaborations is the way to go. Preparing for the future, we need better technology, newer technology to come in. CRISPR-Cas9 is one of them. CAR-T technology is a revolutionary technology for the treatment of cancers. It is very personalized and works on will specifically work on each and every patient. monoclonal antibodies. In our country, we don't have a big manufacturer of monoclonal antibodies. All of them are procured from different countries. Regenerative medicine, biorefineries, and aerobic cultivation of rice, that is also called low water using rice. So as you know, paddy fields are full of water. So a lot of water is required to grow paddy. So now newer strains of rice are coming up, which don't use that much of water. So it leads to saving of lot of fresh water. So we need solutions in that. Taking science to society, whatever invention you are making, it will only be fruitful if it is accepted by the society, right? So what you need to do is you need to have a research that is focused on the society at large. Until and unless there is acceptability for that particular invention, the invention is worthless. So that is the first rule of patents. So for a patent to be applied, you need novelty, you need commercial viability. So if anything is not usable, you cannot patent it. So this is just a glimpse of BIRAC. More than 1,000 startups have been funded. They have a funding of around 2,057 crores. 75 bioincubators have already come up, and 4 regional entrepreneurship centers have been set up. One is in Delhi that includes ICGB, RCB, THSTI, IGIB. So these are some big players in our country. So I will take any questions that you have. I think more time should be spent on making sure that all the queries are taken care of, right? Thank you. Any questions? Thank you. Generic drugs are drugs that have their patent has been expired. So anybody and anyone can manufacture them. So if tomorrow you want to manufacture paracetamol, there is nobody to stop you. You can manufacture paracetamol, you can sell it. Yep. But if you go to US and buy paracetamol, it will be still very costly. Sorry, sir. On Indian drugs? No, sir. I want. There are some black sheeps, but if I take Baddi alone, we have around 2,000 pharmaceutical manufacturers there. I don't believe like all of them have suboptimal or bad drugs, because we are exporting them. We are using some in our own country, but most of them are exported. So yes, sometimes some issues may come up, but it's not only about the quality, because we have not spent on the R&D. Why Pfizer charges so much? I will give you one example about pharmaceutical industry. From 2001 to 2010, the R&D budget of Pfizer was $100 billion. Just the R&D budget. And in that period, they could only make 14 drugs. So it's a different story that they would get back those $100 billion within 1 year. But still, they spend that. In India, what happens is there are research teams that make a copy, and then they sit down and wait for the patent to expire. So if the patent expires today, tomorrow you will have the drug in the market. So when you are not spending on the R&D budget, your drugs are going to be cheap. And like I said, our manpower is cheap. So cheap. Yes, sir. Recently. Sir, like I said, there are black sheep, right? So like Vocard has some queries. Panacea had some. Ranbaxy was closed because there were 3 different cases against them. $500 million, 250, 250. 3 cases that I know of. Even Daiichi could not save them. So yes, quality issues are there. There may be in some cases, but as you know, we are supplying COVID vaccine to the whole world. So slowly and steadily, we will have to take care of that. Quality in India, as you know, we don't, go into that much, but we have to.
हाँ, इसमें मैं स्पीकर के साथ ऐड ऑन करूंगी. स्पीकर मुझे करेक्ट कर सकते हैं. बीइंग ए केमिस्ट्री पर्सन, ये जो जेनेरिक ड्रग की बात होती है, तो जो कॉमन उसमें पॉपुलेशन में आता है कि लाइक वही सेम केमिकल फॉर्मूला जो है वो डिफरेंट नाम से डिफरेंट कंपनी जो है डिफरेंट लेबल पे उसको सेल आउट करती है, बट सेम केमिकल होता है. तो दोज हु कैन एनालाइज दे नो दैट ये इसमें यही है, तो वो सेम ही ड्रग है. डिफरेंट, कई बार आप डॉक्टर्स के पास भी जाते हैं तो वो डिफरेंट नेम में, क्योंकि उन्हें पता होता है कि हम यही लिखेंगे तो हमारे पास आने की क्या जरूरत है, so they write down the name on in a different name. That is one. And I agree with the speaker कि जो FDA करके है, जो टेस्टिंग एजेंसी है, that is same for cosmetics and these medicines. तो वो टेस्टिंग वाला भी जो पैरामीटर है, थोड़ा सा हमारे यहाँ अभी उसमें एक कमी सी है, जिसकी वजह से इतने साइड इफेक्ट्स और इतनी सारी प्रॉब्लम्स हैं. तो दैट नीड्स टू बी, बल पॉलिसी लेवल से लेके बहुत सारी जगहों पे इसको कंट्रोल करने वाली बात है. स्टिल वी हैव created history in vaccines. Yeah, thank you.
No, one thing I would add on quality. Outside America, India has the maximum number of US FDA approved manufacturing facilities for drugs. So in that sense, we are doing something good. That is it. Which one? Sasta? No. We should keep that mindset, not change it. Huh. That is important.
So with this, can we wind up the talk? Okay. Thanks. Abhi,
They will continue with the question.
I didn't get the question. BCG vaccine. Are insufficient for what? The immunity is insufficient? You are asking that? Okay. So in TB particularly, you have a lot of, like I said, antibiotic resistance. So that's why bedaquiline has come in, which is from Johnson and Johnson. I think Dr. Anil Kohl was the one who discovered that. So we have newer and newer drugs coming in, right? So in TB, you have TB, you have MTB, you have XTB, you have TTB. That is TB, multi-drug resistant TB, extremely drug resistant TB, totally drug resistant TB, right? So the bacteria is very hard. It is very hard to penetrate for the drugs. And there are so many, जितनी funding TB के ऊपर है, उतनी funding किसी और बीमारी के ऊपर नहीं है इंडिया में. In India, government has a central TB division under the Ministry of Health. You have US aid, you have Bill and Melinda Gates, you have Chai Clinton Health Initiative. You have so many funding agencies that are putting billions of dollars every year in our country. WHO has made 2030 as a timeline for elimination of TB. Modi ji has kept 25. But then COVID happened. So TB is very resistant, but there are newer drugs that are coming in. Again, this particular one is under patent, so it is very expensive, but government has regulated the prices, but it is being supplied in every state under NHS. This particular drug, which kills the resistant bacteria, is being supplied. So government is spending too much on getting effective healthcare to everyone, and that is good because private sectors won't venture into it because the drug is regulated. There is no profit margins. So government comes in, and that also gives other people opportunities to work in particular field.
the list of questions will be endless. Research will continue and resistance drugs will continue to be manufactured. With this note, I extend my gratitude and thanks to our alumni, Dr. Mahesh Dhar,
Well, thank you so much, sir, for such an informative talk. It's really nice to have such great minds amongst the young minds to boost up their skills and to bring out the best from you all. We look forward to speakers like Pavan Dhar sir, Mahesh Dhar sir, and we are really thankful for being an alumnus of this college as well. Sir, I would now request our principal sir to present a memento as a token of appreciation to our alumnus, Dr. Mahesh Dhar. DBC looks forward to have more such alumnus in coming years. A big round of applause. Yeah. Oh, acha. Okay. Thank you, sir. Calling upon the next speaker, Dr. Sapna Ratnakar. To welcome ma'am, I would request Dr. Sure. Okay. Sorry for the same. Yeah, just a minute. Okay, so there's a slight change. We would like to have Dr. Debjyoti Dhar to be welcomed by Dr. Shailendra Mohan Jha, sir. Please, sir. May we have a huge round of applause for sir? I would now request the chairperson to kindly introduce our speaker. Thank you, ma'am.
It's the centenary year, and University of Delhi is making concerted effort to connect with DU alumni. And here in Deshbandhu College, in the National Symposium, we have another esteemed alumni, student of BSc Biochemistry 2001 batch, Dr. Debjyoti Dhar. He received his PhD in molecular biology from Indian Institute of Science and has postdoctoral research experience from UMass Medical School. He has over 15 years of experience in academic and industry research and development activities, especially my heart, sank when I read this, metabolic syndrome, type 2 diabetes, and gut health. And they all are mostly lifestyle diseases. He holds and he has been successful in various leadership positions in companies with roles in R&D, business development, corporate communications, and consultancy. And there are some interesting aspects of his personality also. He is an avid reader with keen interest in quantum physics and holistic medicine, and he writes regularly on his blog. इसका नाम भी दिया हुआ है www.debIISC. So DEB is short form of his name, IISC, from where he received his PhD, .blogspot.in. And he has also co-authored a book, I, Microbiome, A Secret to a Healthy and Balanced Human Body. He has also been a regular on various science talks, shows on Doordarshan, as well as on German DWTV. We, Deshbandhu College faculty and students, feel proud that he is the co-founder and director of South India's first microbiome company, Leucine Rich Bio Private Limited, and has won various national and international awards, including the prestigious, so today the buzzword is startup, National Startup Award 2021 constituted by Government of India. We welcome you once again, Dr. Dhar.
Thank you, ma'am, for the introduction. And again, I hope audible hai? Yes, sure. So I was a student of Department of Biochemistry, 97 2000 batch. So I passed out from the college in the year 2000. Then my journey took me to MSc from again University of Delhi, Ambedkar Center for Biomedical Research, ACBR. And from there I went to IISc for my PhD. And of course, I never realized then that I would be an entrepreneur, because we are not trained like in our college days. And I'm talking about late 90s, early 2000s. Entrepreneurship was not there. It's still not there, even now. I mean, I'm still struggling to get into that zone. But yes, I mean, that's been a journey. And thank you so much for the kind introduction, ma'am, again. It's a pleasure. I have been wanting to come to university, this college for the last so many years. COVID happened. I had a virtual talk, I think in 2021, where I shared something about the gut microbiome. But that was a virtual talk. So I wanted to come here personally and see everyone. So thank you for the opportunity that you have provided to me. Okay, now coming to the talk. So I basically wanted to share some aspects of an entrepreneurial life, especially coming from a biological background, because as Dr. Mahesh was also mentioning, it's not easy coming from a biological background to get into entrepreneurship. So I thought, let me share some of my my journey with all of you. So this is how we have to basically begin. As a student, what you look for when you go up the ladder, you progress in your life. There are two aspects. One is your financial satisfaction. Second is your professional satisfaction. Now, both of these need to be balanced, because if you are financially satisfied and professionally down, you won't you will have burnout very easily. And if you are professionally satisfied and financially not, again you'll have burnout very easily. So this balance has to be made. Sorry, I clicked on something wrong. Okay, so all of you are doing graduation here. So most of us, when we finish our graduation, there are a lot of paths that we will get to choose. What I'm trying to say here in this particular slide is that as you move on the ladder, the opportunities might increase, but so will the competition. So let's start with your BSc. You finish your BSc or BTech. You will have some job prospects. Now, even it is much more than what we used to have when we passed out. But then the financial compensation would be very limited, because graduation, you will not have that experience and so on and so forth. And hence you might have less professional satisfaction. But it's not that you cannot go for a job after your graduation. You can, but it depends on your mindset. Okay. Then comes your MSc MTech. Here again, you have the option of doing higher studies in India. You have the option of doing higher studies abroad. And then of course you will have job prospects, and all of them have their own positives and negatives. So you have to basically choose based on your mindset and your requirement, from your family or from your own self. You move further, you come to PhD. And mind you, doing a PhD looks very nice from outside. It's very, very tough. It's like 5 years, 6 years of your prime youth need to be completely immersed into something that, probably later on you will be very happy about. So once you finish your PhD, again, your job prospects probably will be higher, because now you're much more qualified. You've already spent few years in something that you have done. You might get a better pay also. It might not be ideal, but again, it's a test of patience. So think about it and think hard. Okay. Once you finish your PhD, and this is basically for the biological or life science students, I'm giving this information. You go for a postdoctoral research. Now, in our times, that's the only thing we knew. PhD ho gaya, ab kya karna hai? Postdoc karna hai. That's it. But from today's era, you have lot many options, and that's why few slides, I'll also take you through what are those options. But so once you do your postdoctoral studies, you will have definitely a higher prospect, a better pay. But again, competition will be very high. So it's like a pyramid. As you move on, move up, uh, those things will happen. So now, okay, you have completed your education, but now you are still scratching your head. Ab kya kare? PhD ho gaya, postdoc ho gaya. What do I do? Okay, now in today's era, there are a lot more avenues that you have. Okay, so I'll take you through all of these one by one. Some of them you might be familiar with, some of them you might not be familiar with. So the easiest thing is R&D in academia and industry, because you have this background, your training has been such, so that becomes the lowest hanging fruit, right? So you have options right now. There are so many startups that can give you that exposure in R&D. I'll also talk about something about drug discovery, but Dr. Mahesh was had just highlighted the generics and all, but that will be later. So then the next is the consultancy market. Again, consultancy market, people need PhDs, okay, and MScs or MTechs, because what they do in consultancy is, for example, I'll give you my experience. So I was working in a consultancy firm in Gurgaon way back in 2010 or 2010, 11. So there our objective was to look at a particular, let's say we were working on type 2 diabetes, okay. Before that, I was working in an R&D setup. So I was a senior scientist in a lab. I knew everything about diabetes in terms of the biology. Okay, what are the genes involved, which organs are involved, metabolites are involved, but I had no idea about how the pharma industry works in that particular domain. So I was like a Cooper Manduk. Okay, so I wanted to know more about how pharma works, and that's how I went into that consultancy firm. From my talk, you will realize that I have taken a lot of leap of faith in every domain. So in the introduction, as ma'am said, I have had a experience in R&D, then corporate communication, then business development, consultancy. So all of these things were never taught to me. So it was always on the job. But all of these actually helped me in my startup journey. So that I'll come to later. So anyway, so in the consultancy market, so the kind of job which I was doing at that point of time was to look at type 2 diabetes, look at what are the different drugs that are there in phase 3 clinical trials, what are the drugs which are in phase 1, phase 2 clinical trials, even in preclinical stage. So that kind of understanding started to develop. And why do they choose people like us? Because we understand biology, and you can talk to the scientists and the doctors in the same language that they understand. So hence, that's a big market that many of you might be interested in as you move on. Then of course, business development and sales. So business and development and sales, they look pretty interesting, but they are tough things. If you have good communication skills, if you know how to convince the other person, and I'm talking about life sciences, so scientifically, okay? You cannot just say anything, ki, take this and you will be cured and all those things. Oh, kaam nahi karta hai. So you have to be scientifically right. You should have a very good communication skills, and all these things, should come from within, because you are the best judge to know who you are. So if I'm a scientist and I know that I can speak well, that is something that you can really opt for. Okay, then application scientist. So this is again a technical job. What happens here is that there are so many reagents, so many instruments that are now available. So what the role of these scientists are basically to go to the end user, explain the technology behind those instruments and the reagents, and help them troubleshoot if that is required. So that's again a job which is now more prevalent, which was not there in our times. Technology transfer, again, a lot of my friends who have done PhD are now actually technology transfer agents in US. High paying job. Basically, you have to understand the IPs better. If you do some courses on intellectual property, you'll be adding to your understanding. But again, this is again an option which has come up really fast in the last decade or 5 months, 5 years. Scientific writing, Again, a very interesting job profile. Many of you might have a flair of writing good. So this is something that you might also look at if you think the other options are not working. And then recruitment, this is not that great, but I have seen people with PhDs heading some recruitment agencies who recruit specifically, scientists and, people like that. So it's there. In my scheme of things, this will not be on the top. And of course, entrepreneurship, this is something which we will discuss in detail. This is the latest entrant in the options that we have in the market. It's the toughest one, but it gives you a lot of satisfaction. And I'll talk about those satisfaction, what I mean by that satisfaction. It's not financial, by the way. Okay, since it's all about entrepreneurship, so let's start delving deep into this particular term, entrepreneurship. This is a buzzword. When I started this company in 2014. I didn't know anything about entrepreneurship then. It was just a call of the heart to start something in this. And I'll give you those details later. So see, as the slide suggests, it's a very tightrope walking. Okay, there are three critical things for an entrepreneur. First, you have to have integrity. Without integrity, nothing will happen. So integrity is must. Second, you should have risk-taking ability. This everyone knows. Without entrepreneur, all about risk. You have to take that risk. But most importantly, and that's why I've highlighted it in a bigger font, is patience. Tons and tons of patience. Okay, things will not move as per your choice or as per your thinking. But then you have to keep patient. So this is the crux of entrepreneurship: patience. Okay. So before you start this journey, there are a few questions or few things that you should know. Okay. First is, you have an idea. Ask yourself, is there a market? Because I can have hundreds of ideas, but is there a market for that idea? That's one question that you have to ask yourself before you take the next step. Second, are you adding any value? So there can be a product in the market and you have a very interesting take on that. So you're adding some value to the product. Then that particular has a very good product has a very good future. You have to work on your business plan. Now, I'm sure many of you here in this audience are not well versed with these terms, especially the business plans and all those things. Even I was not. For me, at that point of time, it was mostly technical. So I used to give this very low kind of thing. But this is very important. This is critical. So unless and until you have a business plan in mind, things might not work out. Then you should have a proof of concept. So one is your idea. Second is whether the idea is actually workable. So as Dr. Dhar was also saying, there are a lot of incubators right now where you can actually try your products or ideas, come up with a proof of concept, and then go to investors. If you just go with an idea to the investors, the chances are they might not be very convinced. So have a proof of concept and then go to the investors. And the most important thing, think about the financial ramifications. Okay, I know what you read in the media is about entrepreneurs getting rich, super rich, which is true, but that is only 1% of the entrepreneurs. The 99%, they don't. And it takes time. That's why patience there is also very important. When I'm putting these financial ramifications, think hard about your personal finances. The next 5 years, when you are launching your product or you're working on this entrepreneurship, think 5 years ahead. Do you have a family to support? If yes, do you have enough resources to do that without any money? Because as a founder, even if you get funded, the chances are that you won't be able to take salary in the first few years. Okay, so keep that in mind. And then, of course, when you go into these kind of entrepreneur kind of a role, please get yourself aware with these kind of terms: seed funding, venture capital funding. What is the difference between seed funding, venture capital funding? What is a term sheet? Okay, what is drag along and tag along? So from my experience, I didn't know. In 2014, I didn't know any of these. Okay, I knew some of this, but drag along and tag along and all these, which will come in the term sheet, was unknown to me. And to be very frank, once you become an entrepreneur, you'll become a salesman, you'll become a lawyer, you'll become a scientist, and you'll become the peon also of your company. So it gives you, a full 360-degree view of everything, that you have to do. So right now, when in my company, whenever there's a legal contract, I draft it myself, because that's how it has become. पैसा बच जाता है company का, and now that I know, yeah, हो जाता है. When you start seeing so many drafts day in and day out, हो जाता है. But yes, so once you decide to take on this journey, please do some search and try to acclimatize you with these terms. And these are just snapshots. I mean, there are so many terms that you would even now when we meet investors and all, they come up with some new terms and वो समझ में नहीं आता हम लोग को. So then we have to go back, do our research, and of course, talking about terms, there are equity shares, CCPS, compulsory convertible debentures. All these terms you should know about. There is no excuse, I'm a scientist, I do not know it. No, ऐसे चलेगा नहीं, because you have to know, otherwise people will fool you. So that's very important. Okay, now coming to the satisfaction part, which I was mentioning, that what is the satisfaction of an entrepreneur? See, an entrepreneur is a value creator. Okay, he's creating value in the society, right? Innovative products, services, whatever you can say. Then he's an employment generator, and this is, to me, I'll tell you, this has been the greatest satisfaction. So the company is employing, let's say, 10 people, 15 people, 5 people, even 2 people. उनका घर का रोजी रोटी चल रहा है because of you, right? And if you can do that, you are actually doing a lot of service to the society. So rather than becoming a job aspirant, an entrepreneurship gives you that kind of feeling, which is unparalleled. Okay, so this is a very important aspect of being an entrepreneur. And of course, innovation. See, innovation, especially for people like us who have been in the science background, it is bread and butter. But innovation, again, when you do an experiment in a lab, when you see a result, Western blot kiya, Southern blot, or whatever you do, and you see a result, and you are the first person in the world to see that result, right? In that dark room or whatever you are doing, what you feeling hai, that is again cannot be equated with money. So these are the 3 important things that actually makes entrepreneurship so satisfying. Now I will come to my experiences of running this organization called Rich Bio. What were my challenges? Okay, and I will not go deep. थोड़ा सा boring हो जाएगा, but see, this is a pure play life science organization, pure play deep science tech organization. When we started, when we went to the investors during our first few years, even now, they don't understand. वो क्या बोलते हैं? Can you make an app for us? Can you make something like Amazon? They even don't understand that what you are doing is far, far superior in terms of value creation in the society. But anyway, creeping baad mein karunga. About Rich Bios, as ma'am had introduced. So we are South Asia's first microbiome company. So we brought in this concept of gut microbiome test in India. Okay, so what is microbiome? Microbiome is basically sum total of all the microorganisms, their DNA or their genetic material on our body and inside our body. Okay, so that is microbiome. So we won this National Startup Award in 2021. This was very, very tough, a national award, and COVID times and all. So it was very difficult. And of course, we have won a few awards, but that is not important. What is important here is, so we have launched 3 products. And why I'm telling you this is because then I'll get to the challenges that I faced. Okay, so that's why it's important to understand the products. So the first product that we launched in 2018 was called Bugspeaks. It's still doing good. It's South Asia's first gut microbiome test, and it's an at-home consumer test. Basically, gives you a snapshot of your gut health based on your gut microbiota profile. And we have some patent pending algorithms, and it's been exported now to Philippines and Thailand as well. Second product is called Rich Biome. Okay, so Rich Biome is again South Asia's first nutraceutical, which is based on the Indian gut microbiome data. So uh, the first product in this is Rich Biome Indus, which is basically a symbiotic. What is a symbiotic? Symbiotic is a combination of probiotics and prebiotics. Okay, so what happened was in when we launched BugSpeaks, though there were a lot of in the report, in the BugSpeaks report, we used to have a section where we used to give information about the probiotics missing in the gut. Okay, so people used to go to the market and they said, "हमको तो मिल नहीं रहा है. These probiotics are not available." So then we realized that most of the probiotics in India are not meant for the Indian gut at all, because wo US mein, Europe mein, they have some probiotics and they sell it in India, which is fairly good. I mean, I'm not saying it's bad. So then we thought, let's look at the Indian gut microbiome data that we had and then come up with a composition. So as an experiment, we launched this product in 2021 called Rich Biome Indus for general gut health. And our third vertical is, because we are a scientists, drug discovery professionals, so we wanted to look at the huge amount of data that we have. So it's a big data. So you're looking at trillions of microorganisms and the host, right? So can we come up with solutions based on the gut microbiome data? So that is the third aspect, the discovery aspect that the company right now is working. Of course, I must admit the discovery aspect is a bit slow than usual, because we are focusing mostly on the first and the second aspect. But that's something, the third aspect is something that is very close to my heart, and I think would be seeing some very interesting solutions coming out of it very soon. So what were the challenges? Now that's why I gave you those three products. What were the challenges? So when we launched in 2017, 2018, this concept, microbiome concept is age old. Okay, it's there in the Ayurvedas also. Gut health ka concept, microbiome. But the science is very new. As Dr. Dhar said about sequencing machines, right? So what we do is, so normally in a microbiology context, when you have to do a culture, what do? You take the sample, urine le lo, stool le lo, then you have to basically culture in your lab. You have to grow them, right? Not all microorganisms will grow in the lab because they need specific media, specific aerobic conditions, and so on and so forth. Therefore, you can only look at very few organisms. With the advent of next generation sequencing, NGS, you can actually sequence any organism, including human, in a matter of a day. So if I'll take you back, the human genome was sequenced. The draft was released in 2003, I think. It took 10 years and $1 billion to do that. Now you can do it in $1,500, and it takes maximum 2 days to sequence it. So that's the technology that has progressed so far. We use the same technology to sequence the microorganisms in the stool. Okay, so when we had this concept, or rather the science, it was very difficult to convince the primary stakeholders, which are the doctors. Unfortunately, in India, even the gastroenterologists, who are the primary ones who look at the gut and all those things, very few had awareness about the gut microbiota. Fortunately, there was a doctor who's a Padma Shri in Mumbai. His name is Dr. Amit Medeo. He had gone to the US. He had read about gut microbiome, and he came back and he called us for a meeting. And that's how we cracked our first so-called client, right? So all disease begin in the gut. Hippocrates, father of Western medicine, even Ayurveda has concepts like Prakriti, Yama, and Agni. However, the awareness in the market was very, very less. So that was the challenge. Okay, the nutritionists, the doctors, even the general public. आप general public से पूछो gut health क्या, तो Yakult बोलते हैं, So which is good, because that's how Yakult has marketed their product. But the fact that now the gut microbiota is so important to our health was not very well known. So this was our first challenge. The second challenge was that it was very expensive. The product was very expensive because of the technology. But anyway, so when we went to the key stakeholders, okay, when I'm saying key stakeholders, I mean for our kind of product, they were the doctors, the nutritionists, the wellness coaches, and so on and so forth. Mostly they had an inertia to try anything new. Okay, they had this inertia, Newton's first law, right? Inertia to upgrade and update information. Many of the doctors, again, nothing against doctors per se, but उनको शायद time नहीं मिलता है, and they were not keen to upgrade and update their information. Okay, The third was lack of collaborative spirit. So in my initial days, even now, when I go and meet doctors or I give a talk in conferences, I always say, please come and let's collaborate. There are so many things, aspects on which we can collaborate, but that is still lacking. Of course, things have improved. Last 3 years, 4 years, things have improved. I'm saying when we started, what were the challenges and how we went about it. Coming to the investors, investors and entrepreneurship, you cannot just separate out. Oh, they're like Siamese twins. Okay. In India, unfortunately, the inhibition to venture in with new age concepts is it's very pretty strong. I'll give you an example. So there's a company called Day2, DAYTWO. Aap Google search karna baad mein. This is a company which is based in Israel. Okay, works on the same concept as we do. They have secured funding close to 60-70 million dollars till now. And when I go and speak to investors, I always say, you are looking at the Indian gut microbiome, which is so diverse. See, Israel is a very small country, right? India is huge. Kitna diversity hai. South Indian gut microbiome is different from North Indian, East Indian, West Indian. So everything is different. So you get to see the data. And from that data, you can actually come up with so many interesting solutions. But unfortunately, the investors don't have that mindset. Unka horizon is very, very limited. So they want ROI. Again, a very commonly phrased word, return on investment. They want that ROI to be, quicker, which in deep science tech-based companies, it might take some time. Okay. Then again, as I said, mindset of following a set pattern. So recently, if you see, there were a lot of hoopla around cryptocurrency, right? Crypto, there were so many apps coming up. Put your money in crypto. I mean, so a lot of investors put a lot of money in crypto, and suddenly, sabka paisa jal gaya because crypto went down the hill, right? So this is the mindset. That's something which is clear. See how Paytm became Paytm. Paytm was still there. They were advertising Paytm, Karo, and all those things were happening. But it was the demonetization. When the demonetization happened, it gave a fillip to the digital transaction or currency. That's how Paytm got a fillip. That's how PhonePe came into existence. That's how Google Pay came into existence. So you need a trigger, for you to be lucky sometimes. So that is also so COVID. I'll tell you, in COVID-19, so our website was there, everything was there. We used to hardly get 1 or 2 sale per day before COVID. Post COVID, suddenly the number of traffic to our website increased. Why? Because many people were searching in Google gut health, immunity, gut microbiome. Suddenly this happened. So there's always a trigger that takes certain things. And of course, that I mentioned in the very beginning, the expectation of quick and multiple X of your return on investment is something that many of the investors rightfully or wrongfully, look at. And another thing which I found very, very problematic with the Indian investors is that they expect very high traction or very high sale, in the initial few months, which is again not possible. Especially if you compare this kind of companies with, let's say, app-based companies, you cannot compare. So yeah, with this, I come to an end. My endeavor was to give you an insight about the entrepreneur world. And thank you so much for your time.
Any question from the student side? Yes, why not, Sandhya?
The strains might be different. Species wise, they are similar. So Bifidobacterium, so Lactobacillus reuteri, Lactobacillus rhamnosus, the species are there. Strains might be different. No. Even the phylum level. So when you are talking about microbiota, there are 5 major phyla. They are called Firmicutes, Bacteroidetes, and there are Vericomicroba and Actinobacteria, Proteobacteria, and five major. And of course, you have spirochetes. There is difference in the composition of those phyla also. Okay. Especially in Europe, we have seen that the Firmicutes to Bacteroidetes ratio that varies from even country to country. So UK will have a different ratio than the Spanish, than the Italian, and so on and so forth. See, Indians have more of bacteroidetes. Why? Because we eat a lot of vegetarian food. And food basically modulates your gut microbiota. As someone said, no, you are what you eat. It's actually true. Yeah, yeah. No, you cannot say that, because bacteria as a phylum will have lot many other, like you have Prevotella and other species. But generally with
Please maintain the silence.
plant food, bacteroidetes go up. I think they have done, but yeah, but not specifically Indian spices. One or two, like curcumin and all those things people would have done. But Indian spices, I don't think they have done.
Dr. Dhar, I have a very specific query
Yes.
as a consumer. These days, nutritionists and lifestyle gurus, they talk much about gut health, and their niche marketing is also working on, the gut health. Is there any specific diagnostic test available to understand or to know my gut health? And if yes, what's the price and where is it available? And if it is again yes, then why not doctors recommend it when I go to get my diabetes and metabolic syndrome test? It's not included. If
It is not. It is not.
Yes, I want to know that. Yeah.
So gut health, one, it is right now not any of these Bucks Peaks or whatever tests we have. Uh, it's not a diagnostic test as of now. It's more or less in the wellness domain. Why it is not? Because not many clinical trials need to be done. A bigger so we have just finished a clinical trial, a proof of concept clinical trial with 30 patients, and the output is really good. So in our report also, there is a section where we give a score that we call as rich index, which basically corroborates how your gut health is. If your gut health is good, the score will be high. If the gut health is bad, the score will be low. But since we have not done a bigger clinical trial, and it is not projected as a diagnostic, hence it is not being prescribed as a diagnostic. So that is the answer. It's a nascent science. The science is nascent. So that's why the doctors are hesitant to prescribe it. Number one. Second, it is expensive. Right now, one test costs 10,000 rupees, which is, if you compare with genomics test, like you have those genomic tests, based on your saliva and blood, they do a lot of tests, they give a lot of information. It is still cheaper than that. But still, 10,000 is something that people might not be able to afford that much. But I have seen a lot of people taking these tests nowadays. People with NFLD, type 2 diabetes, hypertension, a lot of these. IBD, for example, inflammatory bowel disease, where you have ulcerative colitis and Crohn's disease. Because see, what happens in those kind of diseases is that you hit a dead end after some time, right? So antibiotics stop working. They go on to steroids. Then steroids side effects, quality of life becomes very difficult. So then they try to find out what else can you do, and then these kind of things help. So we're trying to give a new dimension to the health care paradigm, to change that healthcare paradigm. So it will take time. Maybe in another year or two, you might see these tests being prescribed more regularly by doctors. We do. There are doctors who prescribe these kind of tests, but utna awareness nahi hai.
As a management person, I see a huge, huge, huge market potential in the work which you are doing.
Absolutely.
Yes.
Absolutely. Sir, unfortunately, I personally did not approach the government for any funding, because क्या हुआ था, initial period में the paperwork were very difficult at that point. I mean, initial years में बोल रहा हूँ. Now it has become much more easier. So BIRAC, and in fact, just after this week, I'm going to Odisha for a Government of India and Government of Odisha startup enclave, where it's sponsored by BIRAC. So what Dr. Dhar was mentioning. So now the awareness is much better. The paperwork handholding is much better. Unfortunately, हमारे time में उतना नहीं था, तो I didn't spend too much time on it. I rather went to private investors and take that and do that. So that is the answer right now. We are still we have not taken any money from the government except the 5 lakh rupees that we received as a startup award. difficult है private investors में India में investors it's difficult to tell them about these deep tech science to start from the scratch. As I said, they understand the bandwagons of apps. If you come to them with a Dream 11 sports ka app, they will be very happy because number of downloads will be much better, return on investment is much. But what they don't understand is the 5 years or 7 years of waiting period here will give them much bigger return if we are surviving till that point of time than let's say just an app download company, right? So wo ho raha hai, dheere dheere people are taking that understanding.
Any last question from students? कोई question है?
Yes.
एक प्रश्न ले सकते हैं.
करता है कितना मतलब if you are taking lot of
और add on कर देते हैं. हाँ बेटा.
it's a multifactorial disease basically. So I'll answer him and then I'll come. Is this okay?
Brief.
Yeah, very brief. So if you are taking vegetarian food, your gut microbiota will be different for sure. Because as I said, there are certain microorganisms which grow when they get that kind of input. If you are taking a lot of non-vegetarian food, there are microorganisms that can grow and produce something called as TMAO, which can cause plaques in your arteries. So definitely food plays an important role and there will be difference in the gut microbiota. Coming to type 2 diabetes, so there are a lot of factors starting from your genes to your lifestyle and of course gut microbiota. So the concept is that if there is a chronic inflammation which is coming through the gut to the liver, that also plays a very important role in type 2 diabetes. We have seen remission in type 2 diabetes by just changing their food based on their gut microbiota profile. So it is possible to have remission in type 2 diabetes.
Sir, is there any relation of colon cleaning and the gut?
Yeah, I think so. I think there is because
colon cleaning is
yes.
going on. Yeah.
Yeah, I know. So especially in Ayurveda,
Yeah.
they do that. They have a different term. I don't remember that term, but the
But
concept is
it has the effect
it
on gut.
basically, yeah. So what they're trying to do is they're basically flushing out all the organisms.
No. Colon cleaning is.
It's different. मुझे उसका exact word याद नहीं है, but yes, it does have an impact,
Okay.
and that's all.
Thank you so very much, Dr. Devjyoti Dhar. मुझे लगता है हम लोग same time में University of Delhi Department of Chemistry और ACBR अगल बगल में ही होता था. Even I was from 2000 to 2005 there only. So thank you so much for coming here and gracing our this conference. और सबसे अच्छी और मोटिवेशन वाली बात ये है कि हमारे देशबंधु कॉलेज के ये छात्र रहे हैं, इससे बड़ी बात कुछ नहीं हो सकती. So a big round of applause for you.
Thank you very much, sir, for such an informative and career-oriented talk. I would now request our principal, sir, to present a memento as a token of appreciation to Dr. Devjyoti Dhar, our alumnus. I again repeat, DBC looks forward to have more such alumnus in coming years. Thank you, everyone. Heading towards the last talk of the day, I would call upon the next speaker, Dr. Sapna Ratnakar, to welcome ma'am. May I please request Dr. Ruby Mishra ma'am to welcome Dr. Sapna?
Can I do the honor here? Or what?
Yes, ma'am. Ma'am will introduce the speaker. Thank you, ma'am.
डॉक्टर सपना रत्नाकर, इन्होंने कहा मैं ज्यादा समय नहीं 10 मिनट से ज्यादा नहीं लूंगी, तो इसका मतलब है लंच और इस सेशन में थोड़ा सा अंतराल है. और मैं भी आई एम रियली like I was going through her biodata, and let me share with you. Even I had given, after doing BSc Honors Chemistry from Delhi University, even I had given the entrance examination of BSc Biotechnology. So I was very keen in doing biotechnology. So she has qualified JNU entrance, then she has qualified IIC entrance. So very young woman entrepreneur. कितने हैं इंडिया में और साइंसेज में इस फील्ड में ऐसे काम कर रहे हैं. तो आशा करते हैं आफ्टर 10 years also when we will again do such conferences, है ना, so we will again call you again. So Dr. Sapna Ratnakar, she is a PhD from School of Biotechnology, Jawaharlal Nehru University, an esteemed prime institution. और यहाँ के बहुत सारे जो फैकल्टी मेंबर है, आई एम वेरी नोन टू देम, मिलना जुलना रहता है. तो इट्स अ वेरी very hardcore research that is going on, and now she's has done bachelor's in zoology and chemistry from Bareilly, India. तो बरेली से आके जवाहरलाल नेहरू में नेहरू यूनिवर्सिटी से, and now she's entrepreneur. So what a proud moment for all of us. That's a great thing we can learn. That is what is national education policy also tells about. कई बार हम लोग यहाँ बैठ के पढ़ते हैं, पढ़ाते हैं. I have been teaching, even in September I will complete 16 years in this college. So we have been teaching, we are creating human resource. But how many human resource and development then bring about changes in the society as a whole? So she has a very hardcore research, and she has her research was focused on regulation of biological molecule in cancer biology. And in COVID testing also operating high grade automated RNA extraction machine. तो इन सब पे इनकी महारत है. Analysis of COVID testing report documentation. List is very, very long. So documentation, instrumentation, quantitative, qualitative analysis. जिनकी भी बात करें, even in chemistry, HPLC, IR, DR, ये इन सब में इनका मतलब इनकी महारत है. Then we have she has a well number of presentation conferences she has attended. She has been presently senior scientist in Cordigem Agro Farm, Vasant Kunj. So presently she is working there as a senior scientist, senior scientific officer in Onquest Vasant Enclave, New Delhi. So we wish you all the best, and over to you. Thank you.
अब मेरी आवाज आ रही होगी ना आप लोगों को? नहीं आएगी? ओके. एक्चुअली मैं थोड़ा सा, मैम को भी कंफ्यूजन हो गया, मैं भी थोड़ा बिजी थी. एक्चुअली मेरा डॉक्टरेट जो है वो जेएनयू से है. उसके बाद 19 में मेरा सबमिशन हो गया था पीएचडी का. फिर जेएनयू में जो है लॉकडाउन लग गया था. जेएनयू में लॉकडाउन लग गया था, सबमिशन हो चुका था और पोस्ट डॉक मेरा मतलब सिलेक्शन हो चुका था न्यूयॉर्क में अल्बर्ट आइंस्टीन मेडिकल कॉलेज में. लेकिन बाय चांस क्या हुआ कि जेएनयू के लॉकडाउन का जो कोई रिजल्ट नहीं आ रहा था, ओपन नहीं हो रहा था, दिसंबर तक वो बंद रहा. उसके बाद मेरा वाइवा नहीं हुआ, मार्च तक मैंने वेट किया. मार्च के बाद 2019 में ऑलरेडी मतलब कोरोना हो चुका था, शटडाउन हो चुका था. तभी फिर मैं जेएनयू में ही रही थी, और जो प्रोफेसर पवनधर हैं वो मेरे को गाइड भी रहे हैं. और ऐसा कुछ बिजनेस का था नहीं, लेकिन थी एम्बिशंस कि मैं कुछ कंपनी वगैरह में ज्वाइन करूं. लेकिन सडनली मैं बस रहती थी क्योंकि कुछ करूं बिजनेस से रिलेटेड, क्योंकि मुझे लग गया था कि मतलब पोस्ट डॉक मुझे करना नहीं था, क्योंकि पोस्ट डॉक के बाद मुझे लग रहा है उसके बाद मुझे करना क्या, पोस्ट डॉक करती रहूंगी, प्रोफेसरशिप में चली जाऊंगी. लेकिन मुझे कुछ अपनी आइडेंटिटी बनानी थी कि करना क्या है. तो बाय चांस क्या हुआ था कि मैंने मतलब इसी बीच मेरा मॉलिक्यूलर बायोलॉजी से रिलेटेड है सब्जेक्ट, तो मुझे कैंसर प्रिवेंशन नोएडा में मुझे जॉब ऑफर हुआ था एज अ सीनियर साइंटिफिक ऑफिसर. उस टाइम पे ये कोरोना की सब चल रही थी, बहुत ज़्यादा दिक्कत हो रही. तो स्पेशली रिकमेंडेशन पे मैं वहाँ गई थी, एक प्रोफेसर ने मुझे रिकमेंड किया था. वहाँ से करने वो 10 करोड़ की लैब लगी थी, वो ऑपरेट हमने करी थी सब, मतलब उसको सेटअप भी हमने किया था. वहां से जो लैब सेटअप का मुझे आइडिया भी आया कि किस तरीके से हम बड़े बड़े इंस्ट्रूमेंट को किस तरीके से हैंडलिंग करते हैं, हम कैसे हमें लैब डिजाइनिंग करनी है, वो आइडिया मेरे को बहुत अच्छा लगा। वहां से फिर मैंने आइडिया ले लेके, मुझे मतलब मेरा फाइनेंशियल सपोर्ट अच्छा था पेरेंट्स की तरफ से भी, तो फिर मैंने अपने फ्रेंड्स के साथ में ऐसा ऐसा एक डिजाइन किया था कि हम ऐसा करते हैं कि एक फंगस है, मेडिसिनल फंगस, शायद आपने सुना होगा, कॉर्डिसेप्स मिलिट्रीज। वो एक्चुअली में कॉर्डिसेप्स मिलिट्रीज जो होता है वो हिमालय में ग्रो होता है, एक स्पेसिफिक कंडीशन 3000 की हाइट पे, मतलब उसको बहुत चिल टेम्परेचर चाहिए होता है, एक ब्रॉथ चाहिए होता है, कैटरपिलर चाहिए होता है। अब हमने उसको ही क्यों चूज किया था, क्योंकि लॉकडाउन था, पढ़ भी रहे थे, खूब पेपर पढ़ रहे थे कि क्या चीज हो सकती है लॉकडाउन में, बहुत इम्यून सिस्टम से रिलेटेड पेपर्स हम रिव्यू कर रहे थे। तभी हमें पता चला था कि इसमें जो है कि एडिनोसिन और कॉर्डेसिपिन है इस कैटरपिलर में, और ये जो है ये इम्यून सिस्टम को बहुत ज्यादा बूस्ट कर रहा है, कॉर्डिसिपिन और एडिनोसिन। अब कॉर्डिसिपिन ऐसा क्या कंपाउंड है, कॉर्डिसिपिन जो है वो 3-डीऑक्सी एडिनोसिन है। एडिनोसिन तो है लेकिन 3-डीऑक्सी एडिनोसिन भी इसमें है। लॉट्स ऑफ पेपर हमने रिव्यू करे, फिर मुझे इसका कॉन्सेप्ट आया कि क्यों ना हम इसकी मैन्युफैक्चरिंग यूनिट डालें, क्योंकि हमने जब इसके पेपर को रिव्यू करा था तो 1963 में हमने ये भी देखा था, गूगल से ही हमने भी पढ़ा था और आइडिया लिया था कि चाइना के जो एथलेटिक्स थे वो 13 मेडल्स लेके गए थे। उन 13 मेडल्स में जब उनके कोच को पूछा गया कि इतने मेडल्स आपके पास में कैसे आ गए, क्या ऐसा आप कि कोई उनको ड्रग तो नहीं दे रहे थे, स्टेरॉइड तो नहीं दे रहे थे, उनके कोच को कैच किया गया, फिर उनसे इन्वेस्टिगेशन किया गया, तब उन्होंने बताया था कि वो तिब्बत में जाते थे, तिब्बत में उनको किसी मॉन्क ने ये सजेस्ट किया था, क्योंकि ये जो फंगस है, एक एडेनोसिन हमारी बॉडी में माइटोकॉन्ड्रिया के थ्रू जो एटीपी बनता ही है, लेकिन एक नेचुरल जो सोर्स ऑफ एडिनोसिन है वो नेचर में है नहीं। तो इस फंगस की कम से कम 4000 स्पीशीज थी, जिसमें से ओनली 6 स्पीशीज ऐसी है जिसमें एडिनोसिन बहुत फ्रिक्वेंटली मिलता है। वही कैच अप, क्योंकि कोरोना में था भी कि हमें इम्यून सिस्टम बूस्ट करना है, इम्यून सिस्टम के साथ साथ ऑस्टियोपोरोसिस भी हो रहा था लोगों को, मतलब बोन्स की प्रॉब्लम हो रही थी, लोगों को डिजलिंग हो रही थी, लेजीनेस भी हो रहा था। तो इसको पहले हमने योगा, हमारा सेंटर है जो जेएनयू का, हमने ये प्रोडक्ट थोड़ा लिया, उसको हमने जेएनयू में लोगों को देना स्टार्ट किया, उनको बहुत अच्छा रिजल्ट मिला। क्योंकि जब हमने कोरोना के टाइम पे लोगों ने काढ़ा लिया था ना, उस काढ़े से लोगों को बहुत सी प्रॉब्लम्स भी हो गई थी, इंटेस्टाइन इन्फेक्शन हो गए थे, पाइल्स की प्रॉब्लम हो गई थी, क्योंकि आपको क्वांटिटी तो नहीं बताई गई थी कि कितना क्वांटिटी में आपको क्या क्या मटेरियल यूज करना है, बस आपने लिया, काढ़ा बनाया, ले लिया, हमें इम्यून सिस्टम हमारा बूस्ट हो गया, लेकिन एक एक्यूरेट क्वांटिटी आपको नहीं बताई गई थी। तो बहुत सारे प्रॉब्लम्स हुई थी लोगों को ये काढ़े की वजह से भी। फिर हमने जब इसको दिया, एक अपने लेवल पे हमने मार्केटिंग तभी स्टार्ट कर दी थी, फिर हमने लोगों को देना स्टार्ट करा, बहुत अच्छा रिजल्ट भी मिला। हमारे योगा इंस्ट्रक्टर ने भी हमको, जो कि जेएनयू के ही हैं, तो नींव तो हमारे बिजनेस की वहीं से ही रही थी, 3 साल हो चुके हैं। और इसके बाद फिर हमने अपना बसंत कुंज में सेटअप कर लिया था। 12 लाख की हमारी मशीन्स आई थी, हमने ग्रो करा, 5 महीने हमको लग गए थे कि कब मतलब प्रोडक्शन स्टार्ट होगा, कब प्रोडक्शन स्टार्ट होने के बाद हमने पहली यूट्यूब पे अपनी वीडियो डाली, क्योंकि सबसे पहला आपका मेन जो आता है, आप कोई भी प्रोडक्ट बनाइए, सेलिंग और मार्केटिंग आता है, तो किस तरीके से करेंगे। हमने ठीक है जेन्यू को अप्रोच किया, कुछ एथलेटिक्स को अप्रोच किया, लेकिन वो वहां तक हमारा सीमित नहीं था, हम किस तरीके से अपने प्रोडक्ट को ज्यादा से ज्यादा लोगों के पास तक अप्रोच कर सके। अब फिर ये भी एक मार्केटिंग का सेंस होता है कि वो कितना चीप है और कितना रिच है, मतलब वो आप परचेस कर सकते हो। अगर अभी आप उसको गूगल में सर्च करना, मतलब 2 लाख पर केजी के जाता है, उसका प्राइस है जो हम मैन्युफैक्चर कर रहे हैं अपनी लैब में, 2 लाख, 1 लाख 120 लाख पर केजी। लेकिन जो हिमालय पे होता है उसका 26 लाख पर केजी, क्योंकि बाहर एक्सपोर्ट होता है, तिब्बत और नेपाल। इंडिया और जो गवर्नमेंट है, गवर्नमेंट ने जो नेचुरल कॉर्डिसेप्स है उस पर रेस्ट्रिक्शंस लगा रखा है। नेचुरल कॉर्डिसेप्स पे रेस्ट्रिक्शंस लगा रखा है। क्यों? क्योंकि जो लोग उसको हार्वेस्ट करने जाते हैं तो वहाँ का क्लाइमेट इफेक्ट हो जाता है, 3-3 महीने के लिए वहाँ के गांव के लोग ऊपर जाते हैं, वो अपना सारा झोपड़ी उपड़ी सब अपना लेके वहीं पे सेटअप कर लेते हैं, तो वहाँ पे खाना वाना बनाते हैं। तो क्या कि हिमालय का क्लाइमेट बहुत ज्यादा इफेक्ट हो गया, तो गवर्नमेंट ने इस पे ब्रेक लगा दिया कि आप इसको हार्वेस्ट नहीं करेगा, लेकिन पीछे से चल रहा है, काफी एक्सपेंसिव है, कुछ कुछ लोग इसको कर रहे हैं। तो मैन्युफैक्चरिंग यूनिट के साथ साथ हमने मैन्युफैक्चरिंग करा, फिर हमने जेएनयू में एक प्रोफेसर से बात करी, उनकी लैब में नैनो पार्टिकल्स पे काम चल रहा था, तो हमने कहा क्यों ना सर इसकी क्योंकि इसमें एक एंजाइम जो कि हमारी बॉडी में भी एडिनोसिन डीएमिनेज, इसकी बायो अवेलेबिलिटी हमारी बॉडी में बहुत कम थी, मतलब उतनी नहीं, उतना वो रुक नहीं पा रहा था, जितना ज्यादा वो बॉडी में स्टे करेगा उतना ज्यादा वो अपना इफेक्ट दिखाएगा। तो सर ने हमने सजेस्ट किया कि ठीक है, इस पे भी एक प्रोजेक्ट लिख लेते हैं, रिसर्च वर्क भी चलता रहेगा। तो हमने प्रोजेक्ट लिखा, प्रोजेक्ट हमारा पास हो गया। वहाँ हमारा रिसर्च वर्क चल रहा है, प्रोफेसर रावता मीना है, उनकी लैब में इसी पे चल रहा है, नैनो पार्टिकल्स का काम चल रहा है। और उन्होंने एंटी बैक्टीरियल और एंटी फंगस की प्रॉपर्टी को चेक कर लिया है। आगे और जो हमने नैनो पार्टिकल्स का बताया वो और इफेक्ट हमारा चल रहा है। फिलहाल हमारा मैन्युफैक्चरिंग का है। इसके साथ साथ हमने कंसल्टेंसी भी देना स्टार्ट कर दिया कि नॉर्मल लोग, क्योंकि उनको बहुत एक्सपेक्टेशन थी कि हम क्या रोजगार करें, क्या मिले, तो हमने उनको क्या करा, ट्रेनिंग देना स्टार्ट कर दिया। मेरे बिजनेस में हमने कोई रेस्ट्रिक्शन नहीं रखा कि मेरे साइंस वाले स्टूडेंट ही इस बिजनेस को कर सकते हैं। ट्रेनिंग में हम 15 पेड ट्रेनिंग होती है, 15,000 पर पर्सन लेते हैं, स्लॉट लगता है हमारे ट्रेनिंग का। हम उनको मतलब हैंडलिंग करवाते हैं, माइक्रोबियल कैसे आप स्पॉन वगैरह बनते हैं, कैसे प्लेट्स वगैरह बनती है, वो 2 दिन की ट्रेनिंग होती है, स्पॉन वगैरह सब हम देते हैं। उसके बाद वो अपने यहाँ जाके उनका जो भी अगर मिनिमम जो इन्वेस्टमेंट होता है सेटअप लगने का, जो हमने भी बात कर रखी मशीन वालों से, वो 5 से 6 लाख में उनका लग जाता है, वो ग्रो करते हैं। और अभी तक हमारी कम से कम 65 लोगों को हमने ट्रेन कर दिया है, मतलब ट्रेनिंग दी है, डिफरेंट कंट्री के भी हो गए और सिटीज के हो गए। और अब तक हमारी कम से कम 16 से 17 लैब लग चुकी हैं। दिल्ली में भी, द्वारका में भी लैब लगी है, हमारी खुद की भी यहाँ पे लैब है। इसके साथ ही क्योंकि मेरा डायग्नोस्टिक भी रहा है एक्सपीरियंस, तो अभी मेरा कीर्ति नगर में फ्रोजन बायो लैब, क्योंकि वो हमारा कोरोना का था, तो हमने वो लैब भी रनिंग में कर ली। तो आप जब भी बिजनेस स्टार्ट करें तो मेन मेरा पर्पस होगा कि आप, जैसे कि सर लोगों ने आपने भी बताया, आप लोग बहुत यंग हो और बहुत छोटी एज में हो, अगर आप पीएचडी करते करते उस आएंगे उस टाइम तक, तो काफी मतलब 10 ईयर 9 ईयर हो जाएंगे। और अगर जब आप जॉब के प्रोफाइल में भी अपना पर्सनल एक्सपीरियंस बता रही हूँ, जब आप एमएससी के बाद किसी कंपनी में जाते हैं तो आपका प्रोफाइल क्या होता है, जो पहले से जॉब कर रखा होता है उससे डाउन, क्योंकि उनका एक्सपीरियंस आपके सामने आ जाता है और आपकी एजुकेशन आ जाती है, तो वहां पर भी बहुत आपको क्रिटिसाइज किया जाएगा। तो बेस्ट है अगर आपने माइंड सेट किया है कि हाँ मुझे जॉब करना है, तो कुछ ऐसे रनिंग बिजनेस को, कुछ ऐसे जो भी, अगर साइंटिफिक, अब हमारा भी साइंटिफिक कल्टीवेशन है, साइंस भी चल रही है, मैन्युफैक्चरिंग भी हो रहा है, लोगों को हम ट्रेन भी कर रहे हैं, कोई साइंस वाले नहीं, स्टूडेंट भी करियर ओरिएंटेड मतलब चलती हैं, ट्रेनिंग वगैरह चलती हैं। तो इस तरीके से एक बिजनेस फ्लो हमने बना लिया, जिनके साथ में ही है हमारे सर भी, प्रोफेसर धर भी है, वो भी हमारे लेक्चर वगैरह करते हैं। तो आप सबसे पहले अगर पहले माइंड सेट करिए कि फ्यूचर में आपको मतलब कोर साइंस में रहना है, कोर साइंस के साथ आपको मतलब बिजनेस में जाना है। जैसे का एंटरप्रेन्योरशिप कोई छोटा बात नहीं है, वो होता है कि आपने बहुत सारे लोगों को एम्प्लॉयमेंट दिया, आपका एक वास्ट लेवल हो गया। बिजनेस छोटा सा बिजनेस करके देखे, छोटा बिजनेस साइंस के लेवल पे भी होता है, डायग्नोस्टिक लैब से भी ले सकते हैं, कुछ मैन्युफैक्चरिंग यूनिट से ले सकते हैं आप। बड़ा मतलब इन्वेस्टमेंट की आपको जरूरत नहीं है, क्योंकि आप जैसे बोल रहे हैं सबको ही क्राइसिस हुई है, हमको भी हुई थी, लेकिन वो ठीक है, हमारा फाइनेंशियल सपोर्ट था अच्छा खासा, लेकिन नहीं हुआ, आज हमने नहीं है। लेकिन आप लोग जब सेट करोगे तो आपको एक फाइनेंशियल क्राइसिस आएगी। सबसे पहले कि आपका जो चूज है, आपने किस फील्ड को चूज किया और आप करना क्या चाहते हो बिजनेस में। तो बिजनेस में आप गूगल में देखिए, साइंस से रिलेटेड, जैसे सर ने बताया, सर माइक्रोब पे करते हैं, सर जेनरिक उस पे करते हैं, मेडिसिन पे करते हैं, तो इसमें बहुत से आप क्या इनोवेटिव लेके आते हो। इनोवेटिव आइडिया जब आप लेके आओगे तो समझ लीजिए आपको थोड़ा सा टाइम देना पड़ेगा, 6-7 ईयर आपको देना पड़ेगा। मेरा सिर्फ 3 साल हुआ है, मैंने जो इन्वेस्टमेंट किया तो मेरा इन्वेस्टमेंट भी रिटर्न हो गया और मेरे को बेनिफिट भी हो गया। तो पर्सनली ये है, बहुत अच्छा फील होता था कि मतलब मैं 2 दिन में, मतलब अगर मैंने 4 लोगों का स्लॉट लगा लिया, 90,000 मेरे पॉकेट में आ गए, ठीक है। मैंने जो जेन्यू से अपनी नॉलेज जो होती है, स्पेशली लोग मेरे को रिकमेंड इसलिए भी करते हैं कि उनका टैग है, जिनको उनको नॉलेज है, तो हमें स्पेसिफिक नॉलेज देंगे। हमारा ये नहीं रहता कि सिर्फ हम अपनी मैन्युफैक्चरिंग यूनिट से रिलेटेड, कल्टीवेशन से रिलेटेड, हमारा मेन पर्पस रहता है कि ये बिजनेस जो है आप इसको आगे कैसे कैरी ऑन करोगे, किस तरीके से आपको स्टैंड अप होना है, जैसे ऑनलाइन ऑफलाइन मार्केटिंग, पैकेजिंग वगैरह, ये सब। तो जब आप छोटा सा भी बिजनेस स्टार्ट करोगे ना, बड़ा करो चाहे छोटे, छोटे से स्टार्ट करके आप पहले आइडिया ले लीजिए किस तरीके से, क्योंकि कल को जाके आपने बड़ा इन्वेस्टमेंट कर दिया, लाखों का कर दिया, कुछ होल्ट हो गया, फिर आपको दिक्कत भी हो जाएगी, फ्रस्ट्रेशन भी हो जाता है, फिर लैक ऑफ कॉन्फिडेंस भी हो जाएगा आपको। तो बेस्ट है कि आप थोड़ा अपनी टीम बनाइए, जो जो बच्चे इंटरेस्टेड हैं कि हाँ हमें ये करना है, तो आप टीम बना के आप काम भी कर सकते हो। छोटे छोटे इन्वेस्टमेंट अपना ले लीजिए आपस में और देखिए ग्रो करिए। मैंने वैसे ही स्टार्ट किया है और आज अच्छा खासा है, मतलब 45 लाख तक का तो पहुंच चुका है हमारा। इसके साथ हम अगर जैसे आप लोग डायग्नोस्टिक में अप्रोच करना चाहते हैं तो आपको हम बता दें डायग्नोस्टिक में क्या होता है कि अगर आपकी वो स्पेसिफिक टेक्निक्स यहीं पे रहेगी रिसर्च वाली, वहाँ टेक्निक्स अलग चलती है, तो आपको आपको क्या लेना है कि अगर डायग्नोस्टिक में जाना है, क्योंकि डायग्नोस्टिक पे एक बहुत बड़ा वास्ट लेवल हो चुका है, बहुत अच्छे साइंटिस्ट वगैरह हायर करते हैं, तो उसके लिए आपको पहले से प्रिपेयर होना पड़ेगा। आपके हैंडलिंग क्या आप कर सकते हैं, तो वो ट्रेनिंग भी हम लोग करवाते हैं, कीर्तिनगर में होती है। प्लस आपको बिजनेस रिलेटेड जो भी कोई आइडिया है या कुछ भी हो, उसको कैसे एग्जीक्यूट करना है, वो सब ट्रेनिंग वगैरह भी हम लोग कराते हैं। प्रोडक्ट का हमारा अभी हमारा ऑनलाइन ऑफलाइन सब जा रहा है, यूट्यूब पे आप सबसे रचना कर डालेंगे, लिंक्डइन पे मार डालेंगे, सब आपको मिल जाएगा। 3 साल की जर्नी रही है, स्ट्रगल रहा है, थोड़ा बहुत रहा है, लेकिन ठीक है, रुकना नहीं है, बढ़ना है आपकी। थैंक यू सो मच। अच्छा,
कोई स्टूडेंट कुछ प्रश्न रखना चाहता है? हाँ संध्या।
नहीं मैम, ये मेडिसिन नहीं, ये फंगस है, और इस फंगस में कंपाउंड होते हैं, जैसे मैंने बताया ना, कॉर्डिसेपिन और एडिनोसिन और अर्गेस्टिरोल। एक्सट्रैक्ट निकालते हैं, एक्सट्रैक्ट निकाल के जैसे सप्लाई होता है, रॉ मटेरियल जाता है, फार्मास्यूटिकल्स में भी जाता है, जिनको एडेनोसिन चाहिए एडेनोसिन एक्सट्रैक्ट निकाल के दे देते हैं, लिक्विड फॉर्म में चाहिए होता है वो दे देते हैं हम उनको। इम्यूनिटी नहीं मैम, वो में कैंसर में अभी 2013 में ही 2 पेपर पब्लिश हुए हैं कॉलन कैंसर पे, उसका नैनो पार्टिकल्स बन चुके हैं और ह्यूमन ट्रायल भी हो चुका है, तो ये कैंसर में भी यूज होता है, ट्यूमर में होता है। क्योंकि अगर मैं अभी एक्सप्लेन करूंगी तो काफी लंबा टाइम होगा, अगर सुनने को तैयार है तो मैं एक्सप्लेन कर सकती हूँ। यस यस यस, जैसे डायबिटीज, अभी एक स्टूडेंट का था डायबिटीज 1 और डायबिटीज 2 में, क्या डायबिटीज 1 क्या होता है कि इन केस आपका जेनेटिकल चेंज हो गया, मतलब किडनी में हो गया, किडनी में बीटा सेल होता है, वो इंसुलिन सिक्रेट करता है, इंसुलिन के अगर कार्बोहाइड्रेट ब्रेक करके वो सेल के लिए ससेप्टेबल बनाता है ताकि उसको एब्जॉर्ब कर ले और एनर्जी को मिल जाए। लेकिन क्या होता है, कभी कभी कुछ केसेस ऐसा होता है कि इंसुलिन बनता नहीं आपकी बॉडी में, ठीक है, इंसुलिन बना, कभी क्या होता है इंसुलिन बना नहीं है, कभी होता है इंसुलिन बना है, जो बना है लेकिन वो कार्बोहाइड्रेट को ब्रेक नहीं कर रहा, तो वो एक्यूमुलेट होता रहता है ब्लड में, जिसकी वजह से आपका जो होता है ब्लड ग्लूकोज बढ़ जाता है। अब जो आपने डायबिटीज सेकंड का क्वेश्चन करा था, डायबिटीज सेकंड में क्या होता है, आपकी इंसुलिन बन रहा है मैम, लेकिन वो इंसुलिन क्या कर रहा है, कार्बोहाइड्रेट को ब्रेक नहीं कर रहा है, जिसकी वजह से क्या होता है, वो रेसिस्टेंस हो गया। तो जो कॉर्डिसेपिन होती है वो दूसरे चैनल के थ्रू, दूसरे मैकेनिज्म के थ्रू, एक तो वो मिमिक्री करती है खुद कॉर्डिसेपिन का, सॉरी इसका इंसुलिन का, तो इंसुलिन की जगह वो खुद कार्बोहाइड्रेट को ब्रेक करने लगेगा। तो वो लॉट्स ऑफ हमारे बहुत से कस्टमर ऐसे हैं जिनको डायबिटीज वगैरह है, डायबिटीज हो गया, आर्थराइटिस हो गया, क्रेटाइनिन वगैरह, इसमें बहुत फ्रिक्वेंटली यूज होता है। एनी क्वेश्चन?
डॉक्टर सपना, स्टोरी टेलिंग और स्टार्टअप सक्सेस आपने इतने अच्छे से समझाया और अपनी पर्सनल जर्नी को जो शेयर करा है, आई एम वेरी श्योर माय स्टूडेंट्स आर गोइंग टू बी इंस्पायर्ड in the way succinctly way you put it up, and we really wish you a lot more successes in coming years, and we welcome you and we thank you once again.
Well, can we have a huge round of applause for Dr. Sapna Ratnakar? We are really proud of you, ma'am. And we really are. Thank you for such a lucid talk and such a motivational one. I'm sure it's going to help our students to take up entrepreneurship in their future. Take some ideas, go back home, think over it, and you can call ma'am anytime. Okay. Thank you so much, ma'am. With this, I would now request Dr. Seema Gupta, ma'am, to present a memento to our speaker as a token of appreciation. Thank you so much. I would join one more please. No, I'm not the one. Oh, good. We all are. Thank you. Finally, we are actually concluding this session by having a formal vote of thanks with one of our co-convener. Oh, okay. Before that, we have a small job to do. I would like to thank the chairpersons of this particular session, Professor Seema Gupta ma'am and Professor Ruby Mishra ma'am. And we would like to present to you a small token of love from all of us. Ma'am, these are actually the honey bites. So they are so sweet that you will actually feel the love. Always, sir. Ma'am. Can we have a huge round of applause for our chairpersons? Thank you, everyone. Thank you. I would now request Dr. Saurabh Singh Deo, a co-convener of this 2 days National Symposium, to finally conclude the session by presenting a vote of thanks. Thank you, sir.
Thank you so much, Neha. Wow, these 2 days were amazing. From the point of view of all the students, I feel you must all have benefited a lot. Being a faculty, I'm blessed. I'm honored to have such type of wonderful speakers amongst us. So let's begin with the vote of thanks. It's indeed a privilege for me to be able to provide this vote of thanks at the end of such a stimulating and potential national seminar on potential of startups in the field of biological sciences, startup awareness. I begin by thanking our chairperson, Professor D.S. Chauhan, for his continued support and encouragement of such intellectual endeavor. I would like to thank our principal, Professor Kamal Kumar Gupta, for his able leadership and perennial support for such matters of academic merit as this seminar. It is also because of your bending presence and able guidance, sir, that we were at this Deshbandhu College aimed to achieve such academic milestones on a regular basis. I would like to thank our guest of honor, Professor Payal Mago, Chairman, SEC Committee, Delhi University, our distinguished guest, Dr. Garima Gupta, Scientist F, and DBT Star College Scheme, our special guest, Dr. R.K. Bharti, Joint Director, Ministry of MSME. Each of your august presence informed and exalted this symposium in all possible ways. I seek this opportunity to thank our chief guest, Director, Ministry of MSME, Sri Rakesh Kumar Rai, for his participation and encouragement of our efforts in this symposium. Sir, we express our gratitude for your encouragement for the same. I thank Professor I.K. Singh, Teacher in Charge, Department of Zoology, Dr. Aditya Saxena, IQAC Coordinator, Deshbandhu College, Professor Aparna Nautiyal, Professor Harindri Chaudhary, Dr. Roshni Rajamohan, Professor Seema Gupta, Professor Ruby Mishra ma'am, for guiding and mentoring this beautiful program and sessions. Professor Varsha ma'am. I thank all my learned colleagues, especially Sandhya Rai ma'am, convener, Dr. Vinita Kashyap, co-convener, Dr. Jitender, co-convener, Dr. Monica Bajaj, Dr. Arun Chokar, Dr. Rubina, Dr. Neha, for a wonderful anchoring. Without them, this event wouldn't have been a success. Special mention to our technical support staff, Mr. Ravi and Mr. Naveen, and Ms. Jyoti for airing us live. And Prempalji, our caretaker, housekeeping staffs for the help and cooperation. Lastly, how can I forget you all? It's you, my dear students. Thank you so much for coming and attending this program, and wish you all great success in life. I hope this workshop is going to create a benchmark for your career. At the end, I would request all of you to fill up your feedback form, and then only you will be provided with the certificates. Thank you so much. God bless you all.
I would now request our students to proceed towards BCR, as you must be feeling very hungry. And I would request the teachers to proceed towards the committee room, first floor. Thank you, everyone. Have a good day.